Hello everyone, my name is Tran and I will be talking to you guys about nursing turnover within Australian hospitals and how this impacts patient safety in the healthy workplace. A brief overview of what I'll be talking about is firstly the background of my topic and what research is telling us about nursing turnover in Australia, leadership in optimal patient safety in a healthy workplace, what can a new graduate nurse do to lead effectively during their practice, elements of what makes an excellent leader, and lastly, a quick summary of what I spoke about and what you can do to lead effectively. I will start off by explaining what the issue is. Nursing turnover is where nurses choose to resign from their professional role or move to another organization. Several studies report that low job satisfaction is associated with a greater intention to leave. Why is this issue important? There is an annual turnover rate of 15.1% of nurses leaving the profession or moving somewhere else. It is predicted that Australia will lose up to 1 in 5 nurses every year, which means the healthcare system needs 27% new nurses to meet demands by 2025. The working environment that shows signs of low morale, poor staffing, low resources, and little to no shared decision making impacts the nurse's choice of whether to stay in employment. It is significant in that it can disrupt the workflow and care for the patient. What sort of leadership makes for better patient safety in a healthy workplace? Firstly, transformational leadership has an emphasis in establishing relationships within the team to motivate and reach new heights within the organization. Continuing to self-grow, the curiosity within nurses is evident in great nursing leaders that shares not only clinically based strategies but touches on the emotional aspects of the team. A good way to do this is having weekly team meetings, as this will enhance a healthy workplace to ensure that the targets are met and everyone's ideas are shared and heard. To reduce burnout, employers have the task of providing flexibility in shift scheduling to minimize stress and burnout, and looking after yourself promotes good health and reduces the likelihood of leaving the profession. Nurses have a duty of care to improve patient outcomes, which include knowing when to raise concerns. An example is whistleblowing, when necessary, of colleagues not adhering to organization's policy and procedures to ensure patient safety. This form of moral courage challenges on what would work better as part of our clinical practice. What to expect as a new graduate nurse leader? How can a beginning nurse reduce nursing turnover? It is an ongoing process that takes patience to develop effective leadership skills, along with the support and care of the healthcare team within a safe, reflective learning space to help new nurses attain leadership skills. A sense of camaraderie is established when there is collaboration between new and current nurses. The principles of effective leadership is being able to demonstrate a sense of purpose and vision for the team that is within ethical boundaries. Furthermore, high morale will stimulate the work environment to be enriching for nurses to work effectively. It is expected that new graduate nurses are able to lead effectively as part of their professional scope of practice. This is standard number 2, where the nurse engages in therapeutic and professional relationships. Having the skill to delegate and supervise where appropriate, with the common goal of improved health outcomes, shows leadership initiatives. The desire to lead stems from being taught and encouraged by your mentor and team by providing constructive feedback. This consequently improves the ability and skill to nurture the connections between individuals with a vision for change. But how can beginning nurses become a good leader? The role of the preceptor is to provide moral and clinical support, with a purpose to transition the beginning nurse to a confident professional nurse. A good preceptor shares safe clinical practices, and having the ability to work well with everyone on the floor will encourage the new nurse to adopt that persona and eventually take on the lead to empower the rest of the team. New graduate nurses continually reflect on their clinical practice on the ward environment and figuring out the best approach in working as a team. The use of the available resources and support network will assist in attaining leadership qualities. Evidence-based research plays a role in shaping hospital policy, and nurses are expected to follow these policies and guidelines. In Australia, nurses abide under the Code of Conduct that carries out the legal and professional obligations that they are to be expected to demonstrate. These legal codes allow nurses to perform professional behavior by encompassing honesty, respect, integrity, and compassion. An example of an illegal practice is overdosing a patient. There is a code of ethics that nurses follow in order to provide efficient quality nursing care, as well as valuing the respect for themselves and others. By adopting moral and ethical beliefs, it fosters a positive and harmonious working environment. The transition can be a struggle for many who are starting to practice. However, nurses will gain the necessary skills to become a proficient leader, and these skills are time management, confidence, and patient advocacy. What makes an effective leader in the clinical setting? Research has shown that transformational leadership has positive results on the workplace and better quality care. Embracing innovative approaches and being responsive to evolving workplace cultures entails engaging with the team and the patients to ensure that it is the type of environment that any person would want to be in. A study has shown that the average nursing turnover rate between adopting a transformational leadership strategy and a non-transformational leadership strategy is 13% versus 29%. From this, we can safely say that the transforming approach in leadership can significantly change the dynamics of the workplace, which links to higher patient satisfaction and lower mortality in acute settings. Working cohesively with other colleagues in discussing the practices and values will help in building trust and faith in each other. Being able to work together to prioritize and manage the patients will ensure that care is adequately provided, and committing to learn every day from experience, feedback, and reflection will empower new graduate nurses and all other healthcare professionals to lead effectively. Research suggests that an effective workplace allows valued contributions of the team and everyone's concerns are acknowledged and an action plan is initiated to meet the team's goal. This is carried out through inspiration and motivation with an advanced practice approach. A healthy workplace includes nurturing a culture of openness and respect, in which every nurse plays a role in effective clinical leadership. This often motivates the team to work effectively to meet the organization's targets or goals. Adhering to policies such as better practice procedures will reinforce the responsibilities that needs to be carried out to promote a healthy workplace. Nursing leaders can act as the role model in order to suggest what type of attitudes and behaviors serves best when interacting with patients and encourage the patient to become a part of the decision-making process of their care. The core values encompass the ideals of a great leader, and by executing it within the workplace will create a culture for all nurses to be valued. By embodying the four beliefs, which are collaboration, openness, respect, and empowerment, will enable the healthcare team to reach its goal and continue the vision for excellent quality care. Lastly, just a quick recap of the issue where nurses leaving can affect the organization. Retaining nursing staff with a mixed skill set is important for a healthy workplace and patients' safety through encouragement and strong relations. How leadership is being carried out remains a key indicator in low turnover of nurses and is critical for the creation of positive workplaces. Using a transformational leadership model and adapting it to the clinical setting will undoubtedly reduce the retention rate of new graduate nurses who share the same core beliefs. Being supportive, sharing ideas and values creates a positive change in the team. You're probably still thinking, how can I lead but in a helpful way? It all comes down to practice. Lots of practice. Adopting approaches that can transform the nursing practice and continually inspire others to do the same by keeping in mind what the organization's goal is. Alright, thank you for taking the time to listen, and I hope you have found some new knowledge about how we can prevent nurses leaving this noble profession by displaying positive leadership.